It's okay.
Okay.
So this is a dissection of the clavicle, right? The clavicle is commonly known as the collarbone, right? So there's three landmarks that we want to recognize. This rounder part right over here, this is going to go up to the sternum. This part is called the sternal end. This end over here actually goes to the high point of the shoulder, and you notice it's a bit more flat. This is going to be called the acromial end, right? This is going to meet the acromion process of the scapula. The last landmark that we want to know on the underside, this little teardrop, little water drop type of thing, this is going to be known as the conoid tubercle, right? So this is the clavicle, sternal end. The flat end is the acromial end, and then the conoid tubercle. The second bone we want to take a look at is the scapula. So first of all, you want to be able to recognize the front and back of the scapula. The back has these prominent bones sticking out from it, where the front is more smooth and curved like that. All right, so that's going to be the front of the scapula. This is going to go on the chest wall, and then this is a posterior view. So this happens to be a scapula where we have this long, thin edge over here. This is going to be facing the vertebral column. So this is called the medial border or the vertebral border. Right? When you feel it, it's actually a long, thin edge. The second border we want to look at is this one here that goes out towards the armpit. Right? This is where the ball and socket joint's going to be. This is going to be a thicker border. This is the lateral border or the axillary border. There's another border up on top right here. This is called the superior border. Okay, so where the superior border meets the medial border, right here, it forms an angle. That is the superior angle. Where the lateral border meets the medial border down below, this is the inferior angle. Looking this way, this shallow cup right here is called the glenoid cavity, right? This is for the head of the humerus to articulate with, right? So that's the glenoid cavity. This big ridge of bone posteriorly is the scapular spine, or we could say the spine of the scapula. If we follow it all the way out laterally, it's going to get flat. That is the acromion process. Just anterior to that, kind of looks like a bent finger right here. This is called the coracoid process. This is going to kind of face the front of our chest. Things like our pec muscles, the pec minor, the biceps, they're going to attach to this. So this is an anterior structure. The last structures are three fossas. Above the spine of the scapula, the scooped out area right here, this is called the supraspinous fossa. Below the spine of the scapula, all of this fossa here is the infraspinous fossa. And then turning it around this way, this is the subscapular fossa. Right? And those are the landmarks of the scapula. The next bone is the humerus or the arm bone. We'll do the proximal end first. Okay. This big round part right over here is the head of the humerus. This is the one that's going to go to the glenoid cavity. This, just remember, always faces medial to get your bearings, right? This is always going to face in. So just underneath the head of the humerus, it's not that great on this bone. There's a bit of a constricted area here that goes around like this. All of this here is called the anatomical neck. Right? So this kind of constricted area right there is the anatomical neck. This area here is the surgical neck, because this is where most of the fractures occur in the humerus. So there's two necks on this bone. The head is medial. The next structure you want to look at is on the lateral side. This big bump on the outside right here, this is called the greater tubercle. Right? We're going to see 3 out of 4 rotator cuff muscles face that way, attached there. This is always lateral. On the front of the bone, this is the anterior surface. This smaller bump right here is the anterior, is the lesser tubercle. This is always going to face anterior. If you notice, between the greater tubercle and the lesser tubercle, there's a groove right here. This is for the long head of the biceps. We can call this the bicipital groove or the intertubercular sulcus. This long part of the humerus is the shaft. Now, about halfway down, you may feel a little bit of a roughness right over here on the lateral aspect. right? How do I know it's lateral? That's where the greater tubercle is right there. So right about here, there's a roughness. This is called the deltoid tuberosity. As we continue down, we're going to see the distal part of the humerus. So on the lateral part of the distal humerus, this rounded knob right over here is the capitulum. This is going to articulate with the head of the radius. Just medial to that right here, this is called the trochlea. This is going to articulate with the trochlear notch of the ulna. Above the capitulum, there's a shallow depression. It's not that deep, it's not that impressive. This is for the head of the radius. When we bend our elbow, this is called the radial fossa. And then there's a bigger depression right above the trochlea. This is called the coronoid fossa. This is going to receive the coronoid process when we bend our elbow. On the posterior aspect above the trochlea, there's a big depression known as the olecranon fossa. When we straighten out our elbow, this is going to receive the olecranon process, so we can straighten our elbow all the way. The last two landmarks are above the capitulum and the trochlea, like above and lateral. There's a big chunk of bone right here. This is the medial epicondyle, and not quite as big out here. It's a little bit more rounded. This is the lateral epicondyle. Okay, and that's the distal humerus. The next bone we want to do is the ulna. So how we know it's the ulna, we see the scooped out area right here. This is like a letter U to kind of show you it's the ulna. So the parts of the ulna are like this. This top part above the notch is the olecranon process, or the olecranon. This forms the prominence of our elbow. This pointy area here is the coronoid process. The whole notch right here is the trochlear notch, so that's what's going to go to the trochlea. Now, lying up against the ulna is going to be the radius. It's going to be sitting up against it, so there's a notch right here for the head of the radius. The long part is the shaft. At the bottom of the ulna, there's a round area. This is kind of like the bump at the back of your wrist right over here. That is known as the head of the ulna. And then sticking out distally from there, there's a little point right here. This is the styloid process. Okay? So those are the landmarks that you need to know for the ulna. This is on the pinky side of the forearm. The next bone on the thumb side of the forearm is the radius. So up top, there's three parts. This round part here, this is going to go to the capitulum on the humerus. This is the head of the radius. The constricted area below is the neck. And then this big bump right here is the radial tuberosity. This is where the bicep muscle is going to attach. Right? So head, neck, radial tuberosity. The long part here is the shaft. Then the radius is going to flare out. Just like the ulna, it has a styloid process also. This is going to be the styloid process of the radius. Now, the ulnar head is going to lay up against the radius, so there's another notch right down over here, and this is going to be for the head of the ulna, and that's our radial bone. So here we can see the head of the ulna up against the radius. We can see, so here's the distal part of the forearm. What we want to look at next are the 8 carpal bones. So there's 4 bones that are in the proximal row, and then 4 bones in the distal row. So I'll just name them from the thumb side to the pinky side. The first bone is the scaphoid. The second bone is the lunate. The third bone is the triquetrum. I'm just going to turn it a little bit. This little bone on the side here is the pisiform. This is the trapezium, trapezoid, capitate, and the hamate. Right? So all collectively, these are the carpal bones. Forming the palm of the hand, these bones right here are the metacarpals. Right? So they form the palm of our hand. And then forming the fingers, these are the phalanges. Now, if you notice, from the pointer finger to the pinky, each finger has 3 phalanges. The first phalange here is proximal, the second one is middle, and the third one is going to be distal. Right? So if you notice, each finger has 3 phalanges. The only difference is the thumb only has 2 phalanges. It only has a proximal and a distal. There is no middle phalange. So it's important to also number our fingers. The thumb is digit number 1, or the first finger. The pointer is digit number 2, or the second finger. The middle finger is digit number 3, or the third finger. The ring finger is digit number 4, or the fourth finger. And then finally, the pinky is digit number 5, or the 5th finger.